different for me because I'm driving in my car leaving a video. It's my 7th video. I'll probably say that. It'll be my 391st video. And I'm chronicling the cancer journey that I'm on with my healing process and how it's going. Yeah, I'm doing this in my car because I have my hands quite full today. I've got my daughter with me, and my partner had a surgery today, and I'm taking care of him, and my daughter has a bunch of things due right now, and she's in gymnastics, so I've really got my hands full right now. But it's great. And okay, so I was thinking, gosh, what did I have to say since I last spoke? And then I remembered that I went to see my oncologist. Some of you saw that I posted that I love my oncologist. I mean, he's magical. He has these deep eyes, and he could be, maybe he's faking it, but his amount of presence and level of listening are really unparalleled. I feel so heard when I speak to him, and he's very present, and he, touches my shoulder, or he's very warm. He's a very warm man, and he also knows what he's doing, which is the most important part. So I really, really like him a lot. I just asked for a referral to UCSF. I had no idea that I could. I guess I said that last time. I was going to ask for that. I had no idea I could do it. He said, great. I like Dr. Alvarado. I really work well with him, and I'll refer you to him. So I haven't gotten that information yet, but I'm really jazzed about it, and I hope now that I can get an appointment that's sooner than 4 months, because last time, a few months ago, I was supposed to get an appointment for an oncologist, and that was it's either UCSF or Davis, and it was 4 months out, and this was right when I got the diagnosis. I found out I had cancer, and then it was going to take me 4 months to see an oncologist. I mean, no way. So I said that to Dr. Campbell, my oncologist. I hope it doesn't take 4 months, and he said, yeah, I hope not as well. So I almost left a video when I left his office because I was ecstatic. I was ecstatic. I was like, he just makes me feel so like I'm in really good hands, and he assuages, is that how you say it? Assuages all my guilt. I mean, all my guilt, all my fear. And I mean, that means a lot to me that he can answer my questions, basically. I mean, that's his job. I don't know why I'm so astounded, but it's good to be working with somebody that you feel good about. I really learned that. I had a midwife I didn't love when I gave birth, and I really wished I would have changed midwives at the last minute, because it would have been worth it. But so I'm getting a referral to UCSF for a surgeon, not for another oncologist. And I spoke to a friend up here who also was HER2 positive. That's another thing that happened. I had a great conversation with her, and what she did and what her process was and who she worked with. And wow, I mean, when I talk to people who are also in the same boat, who have cancer, I feel like I'm speaking to a professor of cancer, because it just requires so much learning. And I think that's why I just keep taking one step at a time, because there's just way too much to try to figure out, okay, this surgery, these hormone blockers, this eating protocol, this habits, these supplements. I mean, it's not really possible, I don't think, to know what you're going to do all at once like that. You kind of have to discover it as you go. So the surgeon. So my next step, okay, well, I have another Herceptin dose next week. It's going to be a lot again, but a little bit less than it was the first time. For whatever reason, they give you a ton in the first week, and then they take it down a notch for the subsequent treatments. I did find out I'll get it for a year, which is kind of a ton, but I'm also feeling protected by it in a way, so I feel good about that. And then I have an ultrasound scheduled for 2 or 3 weeks after the next dose of Herceptin, right before we'd be getting the 3rd dose of Herceptin, because Dr. Campbell wants to measure it and see where I'm at, and then I'll have an apples to apples comparison from the last ultrasound to this ultrasound. So I'm really hoping I've got good news. I hope it's not some weird, hard to interpret situation like it was last time, where it shrunk in one way and grew in another. It was really frustrating information. It was just hard to hear that. It's like, should I be excited about it or should I be worried, you know? I mean, overall, I guess neither really help anything, being excited or worried, but it is nice to get excited sometimes. I mean, so what else about that? The ultrasound. I'm driving, so you can see my attention's kind of split. Yeah, and then I'm going to need to decide this whole thing about the lumpectomy and mastectomy. And he basically said that, the oncologist, that if I get a lumpectomy, I have to get radiation. And I was like, no, I don't want radiation. To me, that's the last thing I want. And he basically convinced me that chemo should be the last thing I want. Like, if I need to not get something, don't get chemo. And that's what he's saying to me. And I think that, you know, if you're listening to this and you have cancer and you don't know me or whatever, and you're not just one of my friends following along, take that with a grain of salt. Of course, you have to listen to your own oncologist, but he knows my position, and he knows I want to do not as little as I have to, but kind of, you know. I want to put as few hardcore pharmaceuticals in me as I have to, but I also want to get rid of cancer, so it's, you know, it's a balancing act. So I think that he said that to me for that reason. But my fear with radiation is that it's so close to the heart. When I spoke to the radiologist months ago, he was showing me a diagram of how close they get, and I mean, it's a pretty narrow margin that they miss with the heart, and I feel really protective of my heart. I got the echocardiogram and everything, quote, looked good, which is great, but I sometimes feel, you know, a pull there. I just worry about my heart for some reason. I don't know if I even have a good reason for it. Just an intuition I have. So if I get a mastectomy, then I don't have to do radiation. That's the bonus there. I mean, yeah, I don't have to do radiation. And hopefully I don't have to do chemo as well with getting a mastectomy. I've gotten just much more relaxed about that possibility. It's someone told me a story about seeing somebody who had a scar there where they had surgery, they had their breasts removed, and they felt like just what courage and what bravery it took for somebody to make that choice. And that was a really pivotal story for me. And it also just, I think, getting to this point, I'm like, it's not that big of a deal if I have a breast or not. I also read that, I mean, it is somewhat a big deal, to be perfectly honest, but in the scheme of things, it's definitely not that big of a deal. But I also am nervous about getting an implant. I mean, that's kind of scary for me, because when I was reading about it, it said that I don't know, I'm to the place I need to be. I can finish this. It said that when you're healing from a mastectomy, you're just healing from a mastectomy, but when you get a mastectomy and then you're also getting an implant at that time, you're then healing from that as well. And it's not like that's a problem, but it's additional healing that needs to happen. And I kind of like the idea of just healing from one thing, and then if I choose to do the other thing, then I can do that and heal from that. I like to do one thing at a time if I can, and give it its proper space to heal and, you know, recover from it. So I feel really good about that. I guess something that's happened recently is in the last couple of days, I've been feeling pain again in my breast, and I haven't really felt pain in my breast for months, actually, probably since I was getting the IPT with Herceptin in Carson City. I used to get these kind of like sharp lightning bolt surges in my nipple and my breast, and they went away, and I was grateful for that. And then most of the pain went away, and then the last couple of days I can feel the cancer. It's a strange thing to be able to feel this foreigner in your body. It kind of feels like, I don't know, I actually have no idea how to describe it, but when I'm feeling it, I'm like, oh, it's right there, and I can feel exactly where it is. And maybe I'm feeling something else. I could, feeling something up, feeling something else. I could be making it up. Maybe I really don't know. But what I do know, and I said this on an earlier video, is that one time I had some alcohol, and this was before I knew I had cancer. It wasn't very much at all, but right when I drank it, it went zoop, and it went literally right to the cancer in my breast. So, anyway, I've had a couple times where I've felt the exact place of it, so I feel pretty clear that I know where it is and what's going on there. Where am I at? 11 minutes. So I think that's my update for now. Yeah, my next step is next Wednesday, and then after that, meeting again with Dr. Campbell, and then getting the ultrasound, and then meeting with him again, and then getting Herceptin again. I think that I'll know whether I'm going to have surgery or not. Well, I am having surgery, I just don't know which surgery and when. I hope to know that within the next month or so, because I'm really ready to remove the tumor from my body. I don't really know a lot about lymph node removal, and that's kind of my next step, is to figure out what's happening there, like what to expect with it. I haven't done any research on it. I just kind of keep researching the thing that's like right in front of me, and so that's what's there now, is dealing with surgery. But I also just need to get through the next couple days and keep breathing, because I have a full plate right now. All right, thanks for listening, thanks for being there, thanks for your comments and your care. As always, I tell you it means a lot to me, and it does, so thank you.